News: the Delhi government has banned for 1 year the sale, purchase and storage of all forms of chewable tobacco, including gutka, pan masala, khaini and zarda in the national capital. Now, the Department of Food Safety issued a notification in this regard yesterday, though the gutka sellers claim that the imposition of ban is abrupt and is unplanned without any prior information. Similar notification, remember, was issued by Delhi government last year, but the issue of ban on gutka reached High Court, the hearing for which is scheduled for July. Having said that, will the recent ban, at least for a year, cut some ice with the consumers as well as suppliers and sellers of gutka? And how actually successful is this? Is its implementation going to be at the ground level? That's a big question which only time will tell. A report.
The Delhi government has banned for 1 year the sale, purchase and storage of all forms of chewable tobacco, including gutka, pan masala, khaini and zarda in the national capital. The Department of Food Safety on Wednesday issued a notification in this regard. According to the notification, unpackaged products of chewable tobacco too are covered under the ambit of the ban. The notification states, the manufacture, storage, distribution or sale of tobacco, either flavored, scented or mixed, and whether going by the name or form of gutka, pan masala, flavored, scented tobacco, khara or otherwise, whether packaged or unpackaged and or sold as one product, or though packaged as separate products, sold or distributed in such a manner so as to easily facilitate mixing by the consumer, is prohibited for a period of 1 year. Health Department officials said a notification was issued by Delhi government in September 2012 in pursuance of a series of directions from Supreme Court for a ban on gutka in the city. But since the term gutka was used in that notification, tobacco retailers started selling the components of gutka in separate pouches. This defeated the purpose behind the ban on gutka. The Health Department had, therefore, come up with a new proposal for banning all raw chewable tobacco products in Delhi. Delhi Health Minister Satyendra Jain clarified that the notification has been an extension of the ban that was imposed last year. He added that the Delhi High Court has banned it and it will be allowed only when the court does so.
जिसमें तंबाकू है, तंबाकू की बात हो रही है, जो भी चीज तंबाकू को हम खाते हैं, खाने का मतलब आपके पेट में जा रहा है, वो अलाउड नहीं है इस नोटिफिकेशन के हिसाब से, परंतु हाई कोर्ट की ओर से उसके ऊपर रोक लगाई गई है. हाई कोर्ट अलाउ करेगा तभी ये लागू होगा, वरना नहीं होगा.
Meanwhile, reacting to the ban, BJP maintains that any decision taken by the Delhi government on lines of banning gutka should be well planned, with more awareness being spread. Moreover, the gutka seller feel there should be more clarity and awareness about the implementation of the notification of the ban. At the ground level, though public in general have welcomed the move.
But government should take all measures to protect the illegal purchase and sale and everything, whatever it may. So I think if there is any program framed by the government, it should be public.
नोटिस नहीं है, कोई वो नहीं है नोटिफिकेशन के भाई क्या करना है, कब से बंद हुआ है, हमें तो आप बता रहे तो मालूम पड़ा है.
कई बार लगाया सर, इसके कोई कुछ होता तो है नहीं, वैसे बिकता आ रहा है, प्रतिबंध लगा देते हैं, बिकता रहता है.
According to the World Health Organization's global Audit Tobacco Survey, 26% of adults in India consume smokeless tobacco, including chewing tobacco, the health implications of which are disastrous and life-threatening. Over a period of time, it will be more clear how well is the gutka ban going to cut ice with the regular consumers as well as the tobacco industry. And also, will other states take a cue from Delhi government and replicate similar bans in their states? Although some states have imposed similar ban on sale and consumption of gutka. News Night Desk, DD News.
And in the studio we have Dr. Naveed Wick, Professor Department of Medicines from AIIMS, and let's talk to him about what this ban is really now going to do as far as an gutka addict is concerned. First of all, if you could elaborate the disastrous side effects of gutka consumption, and now with this ban, do you welcome this move? Tell us more about that.
Yeah, it's like gutka consumption or tobacco chewing or smokeless tobacco. It's or tobacco, so they are all the same things, and they have very disastrous like side effects. They cause almost 20 types of cancers. Okay. Cancer starting from nose, from pharynx, from oral cavity, from lungs, even in urinary bladder, and they can cause any type of cancer. And then these cancers, mortality, and
The regular and consistent consumption of gutka may lead to cancer.
may lead to cancer. Then this tobacco, nicotine, which is there, it has other side effects, which are in the form of cardiovascular diseases, and then they become addictive. It's an addiction, so it leads to different lifestyle diseases as well.
Like?
It's a lifestyle disease, you know. It can lead to diabetes, it can lead to hypertension, it can lead to stroke, it can cause lung cancer, it can cause chronic obstructive pulmonary disease, it can lead to obesity also. So basically consumption, it's a bad habit, so we have to ensure that bad habit is taken care of, because bad habit is meaning that I am a slave to tobacco.
Right. So having said that, when one becomes extremely addicted to gutka as a habit, now when you ban its supply, how does one really cope up with it? Because now the rehabilitation of that particular addict is also important. There will be some withdrawal symptoms. Perhaps the addict may resort to other means like smoking or alcohol abuse.
So it is an habit, and it is a bad habit. And removing any bad habit, be it alcohol, be it smoking, be it chewing gutka, be it bad food, there is a need for discipline. And fortunately today is Ram Navami. So Bhagwan Ram is a symbol of self-discipline. He is a symbol of strong willpower. So until unless I have a strong discipline or a strong willpower, I will not be able to take care of any lifestyle disease, which includes tobacco chewing, which includes smoking, which includes even alcohol consumption, right? So what we need to basically do is to have a healthy lifestyle. So how to have a healthy lifestyle? Because the moment I'm going to stop gutka, I am dependent emotionally, physically, and even mentally on gutka. The side effects of gutka will appear in maybe 2 hours, maybe in 4 hours, maybe major withdrawal happens after 3 days.
Yes.
And then
so how does one cope up with those withdrawal symptoms?
So if you do fasting, how you cope up it? You cope up, you get the cravings. So you need a good social support around you. You need friends, you need family, you need the atmosphere in which you are not allowed to take gutka, and you are being supported. Okay, now the side effect is happening, you keep yourself motivated. One is social support by family and the friends and the near ones, not coaxing them, why do you take it, why do you take it? Just letting them, first make them ensure that they are ready to quit. Once they are ready to give them the best social support, because it is a disease.
Counseling?
It is a disease. I would say first go to the social support of the friends, families and relatives. Because and then what happens is, then those side effects, then it depends then telling them to have a disciplined lifestyle in the form of walks, morning walks, everyday walking, then doing some yoga, and then having healthy food, fruits and vegetables, and keeping themselves busy. Because there will be craving for tobacco. If they're not that much addictive, these small measures of keeping themselves busy, then doing regular walk, at least 45 minutes to 1 hour, doing exercises, whether it is stretching in the form of yoga or some other meditation exercises, if they do it for 20 minutes or 30 minutes, having small frequent meals. So these are good stress busters. Ultimately, our aim is to de-stress ourselves by a good lifestyle, disciplined lifestyle.
So a rehab process will entail first engaging, counseling, and also resorting to other constructive physical activities like going for walks, gymming, any physical activity that may suit one.
If I don't get if I don't get the sight of gutka, or my friends are not taking gutka, if my company is good, that is the first step. And then second step is my willpower. Because it is easy to start and not easy to leave it.
But not impossible also.
It is not impossible. Once the side effects are there, a lot of side effects in the form of restlessness, in the form of confusion, in the form of other things which may not happen.
Do you think ban is really, Doctor, do you think ban is really a one-stop solution in order to put end to the whole addiction to gutka? I mean, is it enough?
Again, I'm saying it is a total health. We have to work towards total health. Single thing will only add to the things. But if you want to take care of total lifestyle diseases, then this family support and discipline and the culture of health in the country. So culture of health in the country, if we bring that, instant recesses, if we take small recesses of health, doing some aerobics every 10 minutes
Yes.
for 2 hours, after 2
just
hours.
in few words, in fact, this is also in a way indirectly related, directly related to Swachh Bharat, Clean India, because gutka addicts have this habit of spitting all over. I mean, it creates a lot of mess. There is a lot of cleanliness issues associated with it.
So I have to be proud of myself. I cannot be eating it, my teeth will go bad. So it is
And
important.
spitting anywhere, wherever.
So proud myself. Once I'm proud of myself, I will not spit. I will not eat. I will not eat gutka. I will not spit. So it is important, and my health will be good. So proud Indian is first step. Proud myself is first step. Second step is healthy India, and then it will add to clean India as well.
Clean India as well. We'll leave it there on that positive
And one
note.
more small point.
Yes.
It's like a virus. In computer, if you get a virus, this tobacco chewing is an addiction. It is like a virus. How and where and when and how much it will destroy you, you never know. So virus can cause havoc. It may improve next time, but it's a very bad virus.
All right, leaving aside the nitty-gritties, the legal nitty-gritties, at least the ban on gutka is more adding to the healthy India and Swachh Bharat and Clean India. Thank you very much.
And proud India.
And proud India, of course.
That's
Dr.
right.
Navneet Vig, thank you so much
Thank
for
you.
joining. Well.